The brain is a complex organ that controls every process that regulates our body, from active breathing to our emotions and everything in between. But despite today's topic being about brain tumors, we only have one brain, which is why it's crucial for us to take care of it. I am Joanne Villanueva, welcoming you to this episode of Lifeline, where we improve our lives by feeding our minds. Let me introduce to you our guest for this episode, Dr. Alan Ong, a neurosurgeon, Dr. Bing Calma, a medical oncologist, and Dr. Jason Ko, a radiation oncologist. Today, we have three different doctors with their own specialty in medicine. So as a way to kickstart the topic of brain tumors, may you please explain to the viewers what your specialty is and how it connects to diagnosing or treating brain tumors?
Good afternoon, everyone. I'm Dr. Alan Ong, a neurosurgeon, and our role for treatment and diagnosing brain tumors are we're the ones who get referred for taking out or removal of the brain tumor in the safest way that we can.
Okay, thank you, Doc Ong. And now, Doc Bing.
Hi, I'm a medical oncologist, and our role in the diagnosis and management of brain tumors would be to work with these wonderful doctors in terms of planning treatment and giving systemic treatment together with the other modalities.
All right, now let's proceed to Dr. Ko.
Thank you, Joanne. So for us, radiation oncologists, we use X-ray treatment or other forms of radiation in treating brain tumors, together, of course, with our dear colleagues, our neurosurgeon and our medical oncologist.
Wow, so it's really a collaborative teamwork. Thank you, doctors. Let us move on to the first round of questions regarding brain tumors. Now, for my first question to Dr. Alan Ong, how would you explain brain tumors?
Good afternoon. In layman's terms, brain tumors or quote-unquote bukol sa utak refer to an abnormal growth in the brain. These usually cause signs and symptoms, which I think we'll discuss later, but in the most basic term, it's an abnormal growth in the brain.
All right, so now one of the most common questions is, how would you differentiate brain tumors from brain cancers, Doc?
Actually, brain tumors is a very big umbrella term, no? And under this umbrella term, we have what we call the benign tumors and the malignant tumors. And to differentiate, a brain cancer is a form of a brain tumor. It's a malignant type of a brain tumor.
So brain cancer is under the umbrella of brain tumor.
Yes.
Okay, so for our next question to Dr. Bing, how would you differentiate benign and malignant?
Thank you, Joanne. So, Dr. Ong already mentioned or said terms which fall under brain tumors. So, it's a brain tumor is just that, a mass or a tumor or a bukol in the brain, and it can either be benign or malignant. To really say with certainty whether it's benign or malignant, the difference will be in a biopsy specimen, which will be looked at under a microscope, and there you will see features. Features in the pathology or in the biopsy specimen would show cells which are weird looking, meaning they look different from the brain cells, and then therefore that's malignant. If the tumors are more or less regular, they have very nice borders, smooth borders, more likely they are benign. That is really parang the gold standard, no? But you can actually also differentiate between benign and malignant tumors if there is a mass or a tumor you see on an imaging. Siguro we'll discuss the imaging later, no? But you follow it over time. If it takes a long while, if it takes a long time for it to grow, then likely it's benign. If it's very rapid in terms of growth, then we think most likely it's malignant.
So yeah, it's my first time learning that iba po pala yung itsura ng cells kapag malignant, that you would immediately know if it's malignant or benign. So follow-up question, Dr. Bing, what are the common signs and symptoms of brain tumors, and do this show up immediately once you have it?
Sige. So signs and symptoms are very non-specific. because it can mean anything and everything. Most of the time, patients are asymptomatic, meaning they don't really feel these symptoms right away. Symptoms usually happen when the tumor is big enough to involve other structures, whether it's benign or malignant. So the most common symptom is persistent headache. Ayoko kayong takutin, baka sabihin nyo, ay, may sakit ulo ko, may brain tumor. So it should be persistent, or dizziness, blurring or doubling of vision. Yan yung mga common. Sometimes, depending on where in the brain the tumor is, some would present with difficulty in speaking, or symptoms similar to a stroke, or even behavioral changes.
Does it include po minsan yung mabilis makalimot or hindi naman po?
Pwede. That's possible depending on where exactly the tumor is in the brain. Because for everyone's information, the brain, when you map the brain, there are different areas responsible for different activities of daily living. From seeing, to walking, to thinking, to memory. So the specific symptoms would correspond to the specific area.
Okay, so thank you so much for that, Dr. Bing. And now I have a question for Dr. Ko and Dr. Ong. As a radiation oncologist and a neurosurgeon respectively, what are the common types of brain tumors that you get to handle? Let's start with Dr. Ko.
Thank you, Joanne, for that question. So, as opposed to Dr. Alan Ong, who see most of our brain tumor patients and only see a fraction of them that requires radiation therapy. So, as a rule, the most common types of brain tumor in the benign component will be meningioma. That will be a tumor of the lining of the brain. And among those patients who are malignant or have a malignant brain tumor, the most common type of brain tumor will be those that spread to the brain. So that's called brain mets. And among those brain tumors that are malignant that grows in the brain, the most common cause is gliomas.
Okay, thank you so much, Dr. Ko. Now, what about you, Dr. Ong?
In addition to what Dr. Ko said, actually in our practice, what we usually see depends on the age of the patient. Usually for older patients, what we usually see, the most common would still be a metastasis, like what Dr. Jason said. It's a spread of the tumor from somewhere in your body. For example, if you have breast or lung cancer, then it's spread to the brain. Then that's the most common that we see in the elderly. And then aside from that, the other common tumor that we see, a malignant tumor, would be your glioblastoma. Then finally, among the benign tumors, among the older patients, Dr. Ko again mentioned meningiomas, and that's what we see as well in our practice.
Okay, so thank you so much for that. Now, another question for Dr. Bing. Are there any preventive measures that citizens can do to prevent the development of brain tumors in general?
Before I answer that, Joanne, can I just say two things? First, there are two ways by which many tumors, even brain tumors, arise. First is those factors which are, something you cannot change, like your genetics, your age. So I think when you're asking me this question, you're referring to the second risk factor, which are modifiable, meaning things we can change. Even if it's the brain, one of the things that all of us can do is smoking cessation. Okay, because that's the first that's the lifestyle factor that is mostly associated with all tumors, all malignant tumors. I can see you and so many other and then the other thing that we should avoid is excessive alcohol intake. I am emphasizing on the excessive because we know that smoking and alcohol alone produce mutations in the genes which may lead to cancer. But when they are used together, super multiplied their effect on causing or increasing the risk for cancer. Of course, I will not mention about healthy lifestyle, etc.
Because you already should know about that. Okay, so yung modifiable factors are less smoking and not excessive alcohol intake. Now, for our next question to Dr. Jason Ko and to Dr. Alan Ong as well, is one kind of brain tumor more dangerous than the other? Are there any ruling factors to consider it as such po? So, Dr. Ko.
So, Joanne, that's a good question. So, brain tumors are classified according to the grade, as opposed to other kinds of cancers that is classified using stage. So, the grade is known through a biopsy. So, we usually get a specimen and look at it under the microscope and to see what grade it is. As a rule, higher grade will correspond to higher aggressiveness. In addition to the biopsy, we also utilize imaging through the use of computer tomography and MRI to characterize these tumors.
Okay, what about you, Dr. Ong?
In addition to what Dr. Ko said, no, corollary to what we usually do when we take out the tumor and then we send it for histopath. Usually, some features that would portend or give us an idea that this tumor is more aggressive are areas of necrosis in the tumor, no, and increased cellularity in the tumor, and then other factors such as mitosis in the tumor. So those features, when we see them or when the pathology report comes out, no, that would tell us that this tumor is most likely a aggressive one compared to let's say a benign tumor which doesn't have those features.
Can you see those signs po through CT scans or MRI or pathologist po?
We can see necrosis can be seen on MRI, no? But the other features like cellularity, mitotic figures, those can be seen only in the microscope.
Okay, so at this part of the episode, we will be having a round of mythical operation where we dissect facts from misinformation. And in this segment, I'll be throwing out a few phrases related to brain tumors, and you will be clarifying if these phrases are facts or myth, and of course, explain why. So first question to Dr. Alan Ong. Does brain tumors change a person's personality po?
Like what was mentioned a while ago by Dr. Bing Calma, no? Our brain has different functions per area of the brain. Actually, the brain has 5 lobes, no? Per lobe has a specific function, and it depends on where the tumor grows. The symptoms that it produces will depend on where the tumor grows. For this statement, it's a fact, no? Some tumors, especially those growing in the frontal lobe, they usually cause personality changes in patients that we see. Usually, these tumors are already at a very big size when we see them, no? Especially if the tumor is located in the frontal lobe.
Okay, so parang it's a fact if around sa frontal lobe nagdevelop.
Yeah, frontal and temporal. Usually, they cause personality change.
Okay, so for the next round, Dr. Bing, would you say the brain tumors are genetics?
Fact. It's a fact. Although not all brain tumor. When we say genetics, meaning they are mutations in the genes, this is in this contradistinction with hereditary. So not most brain tumors are genetically associated, but not all of them are hereditary.
Okay, so most are genetic but not are hereditary. Alright, so now for the last round of our mythical operation, Dr. Ko, cell phone usage is the leading cause of brain tumors. Fact or myth?
So it's a myth, luckily. So I myself is an avid user of my cell phone. So some proponent will say that it is related. So there are multiple epidemiological studies listed in the National Cancer Institute in the US that said that there is no evidence that it is related. So we're good with our cell phones.
Thank you so much for debunking that, Doc. And that's it for this episode's round of mythical operations. Thank you so much for clearing all of these myths up. We're actually going to be taking a short break, but stay tuned, our dear viewers, because once we return, we'll be discussing more about brain tumors.
part of this global activity of spreading awareness against cancer. UST Hospital, together with the Tomasian community, is working together to educate our medical staff and patients to contribute in making this world a cancer-free place. Through this effort, may we promote healthy lifestyle, enhance awareness among Filipino people, and make a mark in reducing the global impact of cancer. We salute the men and women who continuously fight to survive and win this battle against cancer. Together, let's close the gap in the treatment of cancer care.
The will to live is a natural desire for all human persons, especially those who are battling diseases just like cancer. The whole Tomasian community, especially the University of Santo Tomas Hospital, through its Benavides Cancer Institute, commits itself in its fight against cancer. Together, as Tomasians, let us support those people who have dedicated their lives in terms of their research and study about cancer. Let us hope and pray for cancer patients that they may have renewed faith and hope that their health may be restored and that happiness may reign in their families. God bless us all.
Welcome back. Before the break, our three lovely doctors helped us understand more about brain tumors, their signs and symptoms, and debunk some of the misconceptions surrounding this health concern. Therefore, for this last segment, we will be discussing the diagnosis, treatment, and lifestyle changes concerning brain tumors. So mga doc, ready na po ba kayo?
Ready na.
Ready na.
Alright, so let's begin. For our first question, Dr. Bing Calma, can you run us through some possible diagnostic tests for detecting brain tumors?
Oh, okay. Thank you, Joanne. Very important is history and physical examination, so that just by history and P alone, you will be more or less able to know where the lesion is. It was mentioned by Dr. Ong a while ago, no? There are 5 lobes in the brain, so just by your history and P, you would more or less know where. And then you go through the imaging. You can either go through a CT scan or an MRI. There are advantages of one over the other, I think, which the doctors should be able to discuss better with patients. And sometimes you need other image or tests that will help understand if it's really something just from the brain or something that has gone through the brain from other parts of the body. Also, additionally, sometimes you also have to get fluid, your cerebrospinal fluid, from whether it's in the brain, intraventricularly, or from the back, from the spine, yung lumbar puncture, to help us with the diagnosis.
Okay, so among all those imaging that you mentioned, what would you say is the most common here in the Philippines?
We have both the CT scans and the MRIs. Yun nga, as I said, it would really depend on what the physician feels is better, because there is some advantage to an MRI and there is some advantage to a CT scan depending on what they are thinking.
Okay. So my next question is, are there any differences in the treatment methods for malignant and benign tumors po?
Of course, definitely, because sometimes, I think Dr. Ong is in a better position to answer this, but sometimes if it's a benign tumor and it's not causing any problems, you may not exactly leave it. You may not exactly remove it right away. But if it's something that's malignant, therefore you have to be more aggressive, and the treatment will depend from surgery to chemo, to radiation, to a combination of radiation and chemotherapy.
Okay, now
Or
Dr.
systemic
Ong,
therapy.
yes. Dr. Ong, do you have anything else to add?
Yeah, in addition to what Dr. Bing said, no, in our practice, our main goal, no, in offering these patients surgery, be it benign or malignant, our first and foremost goal is a maximum safe resection, meaning if the tumor, be it a benign or a malignant one, our goal would still be to remove everything as much as we can in the most safest way that will not debilitate the patient post-op, because even though these patients have tumors, of course we have to consider the fact that post-op, their quality of life, especially if they're younger ones, no. What we usually say to the patients before operation is that we'll do everything we can to remove as much as we can safely. So, yun po.
Okay, now to add to that po, among those procedures such as craniotomy and endoscopic pituitary surgery, are there any side effects that people may experience after doing it po?
Of course, these procedures are very invasive. No, the patient undergoes general anesthesia, and then we usually do a very long or very big skin incision for the craniotomies to take out the tumor. And then we'll do craniotomy, take out the bone, and we'll dissect the brain to find the tumor. And then we'll have to take it out very safely. So one of the side effects, or I guess you could call it complication from these surgeries, that of course if the supply of the tumor is coming from a very eloquent supply of the brain, then once that's damaged, of course there would be corresponding side effects. So again, depending on where the site of the tumor is. Then for endoscopic pituitary surgery, there are several possible complications for these types of surgery. This is a more minimally invasive type of procedure wherein we usually put in an instrument through the nose to take out the tumor in the pituitary area. No? One complication that we see, or side effect, if you may call it that, is the presence of CSF leak. No? We don't want that to happen, or as much as possible, we prevent that from happening, because once that occurs, it's a nidus for an intracranial infection, which we don't want for our patients.
Okay, so since we're talking about surgery, would you say that surgery is considered as the last resort po?
Quite contrary to the statement, actually surgery should be the first option, no, for patients with brain tumors, because as what Dr. Calma and Dr. Jason Ko said, it's a collaborative effort. Usually, their treatment relies on what we get, the specimen that we get. And once the specimen has been sent for histopathology and it has been read that, oh, it's benign or it's malignant, then we can plan out the next subsequent steps in the treatment for these patients. So it's usually the other way around. It's a first line of treatment for patients with brain tumors.
Okay, thank you so much. I really learned a lot from that po. And now, I have another question for Doc Ko. So, are there any physical condition that could be in the way of the treatment process po?
Thank you, Joanne. So we know that all of us are in the different states of health and well-being, especially in patients that are elderly. There might be some comorbidities, for example, hypertension, diabetes, that will affect the probability of these patients getting treatment. So what is important and what we do at Benavides Cancer Institute in our hospital here at UST is that your doctors talk in a multidisciplinary meeting to see which treatment are better and best for the patient in their specific circumstances. So it is being tailored per patient, and what is the best that we can achieve with the goals of the family and the patient as well.
Okay, so thank you so much for that. Now to end, I have a question for all the doctors. What would be your general advice and message to the patients who may be suffering from brain tumor or are currently undergoing treatment po? Let's start with Dr. Calma.
Thank you. So to all patients and their caregivers or their loved ones, I think the most important thing that you should do or you should know is know your diagnosis, know whether it's malignant or benign, so that you can also know what your treatment options are, what are the success rates of these treatment options, and who are the appropriate doctors to talk with, so that you can make informed choices.
Okay, thank you so much. Now, Dr. Ong.
In addition to what Dr. Calma said, though, because nowadays having brain tumor is somewhat of a stigma in our society, no, na some patients would come into us na once, Doc, may bukol ako sa ulo. Parang ayoko na pa-opera, no? So we should, as doctors, I want to advise the patients that once you're given that diagnosis, do not be afraid, no, to consult the appropriate doctor for your diagnosis, so that you can make a proper informed choice on what treatment would be best for you.
Okay, so informed choice din po, like Dr. Bing said. Now, Dr. Ko?
Thank you. So, having brain tumor diagnosis is very challenging. It's not an easy situation to accept, but it doesn't equate for an automatic life sentence condition. So we are here, your doctors, including us, to help you navigate your situation and to explore the options that we can do to help you and to match the goals that you want to have. So that's all.
Wow, that is very insightful po mga doc. And that ends our episode of Lifeline. We give special thanks to our lovely guest, neurosurgeon Dr. Alan Ong, our medical oncologist Dr. Bing Calma, and our radiation oncologist Dr. Jason Ko for taking the time to answer all of our questions. Thank you po again mga doc. Thank you po.
Thank you. Thank you.
According to the Cleveland Clinic, about 1/3 of brain tumors are cancerous. But whether it's malignant or not, we must always be aware that brain tumors have a significant effect on our health. Hence, we hope that this episode not only educates us, but also helps people start a conversation about this health problem in order to live a healthier and better quality of life. Always feel the war by following us on our Facebook, Instagram, X, TikTok, and YouTube page at USC Tiger TV and at USC Tiger Radio. Once again, I am Joanne Villanueva, your host for today's episode of Lifeline, where we improve our lives by feeding our minds.